Trying to get a diagnosis for ADHD as an adult is extremely difficult, and it's important to not only make yourself aware of the process from a practical perspective, it's also very important to prepare yourself mentally for what's about to come. Here, what noise do potatoes make? Hey folks, how's it going? I hope you are well. Welcome to the channel. My name is Cassandra, and this is where I talk about my life experiences and lessons learned to try and help other people who might be in similar situations. So if that sounds interesting to you, please go ahead and subscribe if you haven't already. In this video, I am going to be talking about how to get an ADHD diagnosis as an adult. I am currently based in Germany, and as an adult, I have been diagnosed with ADHD in Germany twice. So the first time was at the end of last year. The second time was the start of this year. So within 3 months, I was diagnosed twice. And yeah, both were in Germany. So this will be based off my personal experiences. It will be obviously the most relevant to people who are also based in Germany. The process will be very, very different depending on where you are. However, I do hope that there will be some general advice, guidance and information that will still be helpful to anyone regardless of what country you are in. And even where the information is very specific to Germany, it might give you some inspiration as to what research you need to do for your own location, what questions you need to ask, and so on. One thing I would like to quickly point out is that there's no such thing as ADHD for children and ADHD for adults. It's the same condition. That would be like saying diabetes for children or diabetes for adults. It's the same condition. Where it does matter, however, though, is with the difficulty in getting diagnoses, the stereotypes, the research, the misinformation and so on. That's where the process is different for adults. So the first thing that I would really recommend you do when pursuing a diagnosis for ADHD in adulthood is to do your own research. I've talked before about how I think it's really important for everyone to conduct their own research, not just listen to, what one particular person has said. I've also mentioned as well that the procedures and the circumstances will be very different depending on your location and of course, obviously on your life and circumstances. The process of getting diagnosed with ADHD and then trying to get treatment for it is very, very difficult. There's a lot of stuff that I'm gonna try and touch upon with as little depth as possible. One, because I don't want to make this video too long, and two, because I think it's better to split it into videos of their own. But trying to get a diagnosis for ADHD as an adult is extremely difficult. And it's important to not only make yourself aware of the process from a practical perspective, like what things do you need to organise and so on and so forth. I think it's also very important to prepare yourself mentally for what's about to come. For me, I already had done a lot of research and I already knew from that it was going to be hard. But still, when I was going through it, I'm glad that I was already expecting it to be difficult, so that when it was really, really difficult, at least it was still somehow in line with my expectations. So with that in mind, given how difficult and painful the process is, I would really also encourage you to very early on and before you get started with the practical elements of it, I would really encourage you to think about why you want to pursue a diagnosis, what you think that will bring to you, what the benefits would be, and also what you were hoping to get from the diagnosis. What is your ideal outcome, and what do you think having the diagnosis will do for you versus not having the diagnosis? Just so that you can weigh up the investment versus the return, let's say, and you can decide for yourself whether or not you think it's worth it. Again, I'm planning to do some videos actually about reasons why you should and shouldn't pursue diagnosis to hopefully try and help people make that decision. However, if you're already at the stage where you're like, no, I want to do this, let's continue. So next then, I would really suggest trying to think about what support you have around you and, try and maybe either ask for people to help you with some of the process of getting the diagnosis, or even just like potentially letting them know like, hey, I'm about to do this thing. I feel like it's gonna get pretty rough. Is it okay if I reach out to you sometimes? If you're like me and you don't have a lot of friends and even fewer closer friends, then this could be difficult for you. Maybe you don't feel that you're able to reach out to anybody. I can certainly understand that. Then I would even more, I would encourage this anyway, but I would even more encourage you to think about your sort of mental health first aid kit or process, so that when things get rough, you kind of like have your go-to, like, okay, this is what I can do for myself to pull yourself out of, whatever dark places you might end up being. Again, just as part of the preparation for the whole process. Certainly for me, as I say, I don't really have a lot of friends, and even fewer closer friends that I feel like I could reach out to in these situations, but thankfully, I did have a select few people who really, really did help me out. If you watch my last video about my ADHD journey so far, you'll know that all roads lead to crying. I cried a lot throughout this whole process. I have other mental health stuff and whatever going on as well, but when I started the process, I really, as far as I can remember, I was really, really struggling with this stuff with ADHD, and that's why I was like, I want to get a diagnosis because I really, really wanted treatment. I was struggling a lot with that, but the ADHD part aside, in terms of like my mental state and my depression, it wasn't amazing, but it also wasn't terrible. Like I felt like I was in, a kind of a decent place to be able to go through the process and to deal with it. But pursuing an ADHD diagnosis and then trying to get proper treatment, it made my depression a lot worse for a good while. And again, I knew that it was not going to be nice. I didn't realise that it was going to be that bad. And a lot of the times it wasn't even about like something in particular happened. It was just, I'm the kind of person where, for me, I'm like, with everything that happens, I'm like, I'm fine. One day, I'm not fine. And everything kind of falls apart. And I had several days where I just felt really, really awful. There were several days where it got to a certain point during the workday and I was like, I have to finish right now. And I just burst into tears and I would just sob, proper sob, for an hour or more. There was one day in particular that was really bad. It was just after lunch and I was already planning on finishing early to kind of take some time back that I'd worked overtime. But right after lunch I was like, I can't wait, like I need to finish now. And I literally just like shut down like, the work programs and stuff. And I started properly crying. I was in a real moment of mental health crisis, to be honest. I haven't felt that bad in a long time. And it was during the work day. I knew that other people, would be at work as well, and I didn't want to bother anyone. I even forgot about this until I was planning the content of this video. I felt so awful and so much in need of help. I started looking up helplines that I could call. As I say, I live in Germany and my German certainly isn't good enough to like try and explain to someone, why I'm upset and what's going on. So I tried to look for ones in English, but even not in English, like I could only find 2 numbers as far as I can remember. Neither of them picked up. I called and called and called and neither of them picked up. And at this point, I could literally barely see because my eyes were so full of tears, and with the glasses and everything, it made it even worse. And I remembered, I used to volunteer for Samaritans, which is a charity in the UK, which is basically like a mental health support line that you can call. And I was like, okay, well, I'll pay the international charges, I'll call them. And that made me really upset too, because when I was trying to find the number, I kept just seeing numbers that were only possible to dial from within the UK. I couldn't find any international numbers. And I was already in such a state that this, you know, it made things worse. But eventually I think I did find like a cached Google search preview of an international number. Like, it wasn't on their actual website. And I called then and I spoke to someone who, I was crying so much he couldn't understand what I was saying. Eventually hung up. I spoke eventually to my partner on the phone, who was like super, super nice, trying to calm me down and stuff like that. And he said that he would come over and just like spend some time with me, just be there with me, which is really nice, and that helped a lot. And then I had also as well messaged another friend and be like, hey, are you busy? And you know that way, just like some of your friends, like when you say that to them, like, hey, are you busy? Like, they know that something's not right, that you're not okay. And so he was like, yeah, give me 20 minutes. And so it ended up like he was out somewhere, but he went back home so that we could talk on the phone. That was really nice. And yeah, I just cried on the phone to him for a long time. So yeah, it was really difficult, and having, you know, these two people there to you know, really help me when I needed them. I'm really, really grateful for that, you know. And I have another friend as well who, again, she would have been at work too, so I didn't call, but you know, she always says to me, you know, whenever you need something, like if you want to chat or just rant or whatever, like, I'm gonna be here. So it's really nice to have these people. You know, there's obviously still some onus on me to take up the offer, to actually reach out to them when I'm in that space, which I'm still needing to practice doing. You know, I tend to not really do that unless things are really bad, which is, you know, on me, and that's not good. I need to learn to be better at that. But anyway, like, I know I'm spending like such a large portion of this video talking about that element of it, and I apologize because I know that that's not like probably what you came for. It's not the title of this video, but I just think it's really important to share so that you understand how serious I'm being when I'm telling you that this is really, really hard. And I'm not saying it to try and scare you or to put you off or anything like that. Like, for me, it's definitely been worth going through this process. But I just want you to be prepared, you know, so again, so that you're not going into something thinking that it'll be fine and easy, when I know that it probably won't be. You know, this is my way of looking out for you and just sharing with you, like, I'm not joking. You know, it's a lot, so just be prepared for that, and just make sure that, you know, you're kind of doing as much as you can to prepare for that, and that you'll be able to manage if that happens. That being said, if you think that you should get a diagnosis, don't use this as a reason to put off doing it or to decide not to do it necessarily. I definitely think that if you want the diagnosis, if you think it's the right thing for you, then still do it. As I say, for me, it's still been worth it. Okay, now that we've got that out of the way, and again, I'm sorry for spending so much time on that part already. But okay, now let's go into the practicalities, okay? So now you've decided for sure, like, that you're doing this you've got some sort of either support system or a mental health first aid kit, okay? Then what you have to do, in Germany especially, is you need to get an appointment with a psychiatrist. It can't be like a regular doctor, a GP, or your Hausarzt in German. It can't be a psychologist. It can't be a psychotherapist. It can't be a counsellor. It needs to be a psychiatrist. And the reason for that is because in Germany, psychiatrists are the only people who are legally allowed to give a diagnosis for ADHD, and they're the only ones who are legally allowed to prescribe ADHD medication if you ultimately want to get medication, either now or in the future in Germany. And the reason why it's so restricted, why it's so difficult to get, and I'll rant about this in another video, but basically people who don't have ADHD abuse ADHD medication. Like, you see it all the time in the media, TV and film. Whenever ADHD is mentioned, all the focus is about how ADHD medication is abused. And it is overwhelmingly not abused by people who have ADHD. It's abused by people who do not have ADHD. And so because they're busy being the it makes it a controlled substance so that people with ADHD also struggle to get access to ADHD medication. As I say, it's a controlled substance, and in Germany they call that Betäubungsmittel. So because it's Betäubungsmittel, only certain people are allowed to prescribe ADHD medication, so that's limited to psychiatrists. And in addition to that, you would think that once you have a diagnosis from a psychiatrist and that you get some, official piece of paper or whatever, you would hope then that that should be fine everywhere in Germany. It's not. They're so untrusting, they're so suspicious, they're so determined to not let people access ADHD medication that psychiatrists in Germany don't even trust other psychiatrists in Germany. And I don't know whether this is an official rule, but all of the psychiatrists that I've spoken to here, they won't even accept an ADHD diagnosis from another psychiatrist. They insist on doing the assessment and diagnosis again themselves, regardless of when you had the diagnosis from another practice. So that's why then I had the first diagnosis in December and then the second diagnosis the following February, and the second practice still insisted on doing it again. So just keep that in mind. If you have public health insurance in Germany since 2011, so only in the last 10 years or so has public health insurance here actually recognised and acknowledged that adults can also have ADHD. So there is an awful lot of misinformation around about ADHD, even amongst medical professionals and so-called specialists, which is another reason why it's very, very important to do your own research and to educate yourself, because you will probably come across a lot of medical professionals who don't know what they're talking about when it comes to ADHD. So the public health insurance, they will cover the cost of the appointments with the psychiatrist and any sort of medication or treatment that you get in related to ADHD as an adult. However, the diagnosis needs to also be from a psychiatrist who accepts public health insurance. I already mentioned that psychiatrists, they don't trust anyone else's diagnosis here. They will only trust their own diagnosis basically. So I guess that already implies that then if you're on public health insurance and you need the medication, that you should get it from the same people. But for example, because it takes such a very, very, very long time, like 3 months or more, usually more than 3 months, to get an appointment with a psychiatrist, I at some point was exploring the possibility of maybe getting the diagnosis privately, like paying for that completely out of pocket, and then just taking the diagnosis to a psychiatrist covered by public health insurance to get the medication. But that's not possible. The public health insurance will also not accept a diagnosis from a private practitioner if you want the medication covered. So as soon as you start paying for things yourself, that's it. Public health insurance, they wash their hands of the whole thing. So that's another thing to keep in mind, which then also limits your possibilities of who you can get an appointment with, unfortunately. Just touching on costs again, as I say, the public health insurance, they will cover the appointments and any sort of treatment you get, but what they will not cover is the assessment itself. So to actually get the diagnosis, they won't pay for that, which makes no sense. But I think it again comes from this thing of they've only just accepted that adults can have ADHD, but they're not willing to pay for adults to find out or to confirm that they have ADHD after moving or something like that. They're not willing to do that, which sucks. So for sure as well, when you're calling and when you're making appointments, check how much it is at that particular practice to get the assessment for ADHD, because there's also no one standard way to assess people for ADHD. Every practice will do it differently and they'll all charge a different amount. It sucks. I won't go into it, but it's to me, it's the height of privilege. I do have that privilege. I'm lucky enough that I was able to pay for that. But my God, if I didn't have the money, then me then, I guess. Do you know what I mean? That to me is just so unjust. It's disgusting. Anyway, moving on. Regarding booking with a psychiatrist, again, it's going to be slim pickings. So you're not going to have a lot of people to choose from as it is. A lot of practices will claim or make it look like they're accepting new patients based on their website, but most of them aren't. So you really need to get in contact with them and find out. You need to contact a lot of them. And because, as I say, the process is so long and difficult, even once you have the appointments and you sit down in front of someone, I would 100% recommend only trying to book appointments with psychiatrists that actually specialise in ADHD in adults. And if you are part of some other sort of minority or marginalised group, even more reason to find a psychiatrist that specialises in ADHD in those demographics. There's a lot, as I say, a lot of misinformation and bias. So if you go to someone, a psychiatrist that doesn't specialise in ADHD, it's going to be even more difficult. And you're basically just going to be wasting your time, in my opinion. So I would really suggest just going for the specialist. Oh, so much criteria. How then are you supposed to find anyone? How do you know who to call? Things to look at would be like online booking services such as Doctolib, Yameda. Try and look up practices like on Google, doing like regular Google searches, also a Google map search. If you're in any communities for your local area, for example, like I mentioned to someone to try looking for Facebook groups. They live in Berlin and they did that and they were able to find an ADHD group specifically in Berlin and get recommendations of practices in the local area. So I would suggest that, find communities as well as sort of regular internet sources to try and find specialists. Additionally, health insurance companies might have catalogues or services of different medical specialists where you can either contact them and tell them your criteria and they'll send you a list, or it might be already on their website that you can search for like the type of medical professional that you need, and then you might find contact details for people that like seem to not exist anywhere else online. So those are a few suggestions as where to find someone to book an appointment with. And then, as I say, just be prepared that a lot of them will no longer accept new patients. Their appointments won't be open, there won't be appointments available. If there are appointments available, you'll have to wait at least 3 months. There's a lot to go through, and of course even more challenging if like you're in a country where you're not confident enough in the language of that country to have such in-depth conversations about something like ADHD. So it's difficult, it's a lot. And that's why it's really helpful if you have someone who is able to support you also in that process. Something that also helped me through that, as I say, you need to contact a lot of practices. There's absolutely nothing about the process of trying to get a diagnosis and or treatment for ADHD that is actually ADHD friendly, and that is a big part of what makes it so difficult. Every single thing that you struggle with because of ADHD, you have like that will be exacerbated throughout this process, and it's twisted in its irony that these people don't even seem to understand the symptoms of ADHD and what we struggle with, that they would be so cruel, is to make us go through all of that, jump through all these hoops to try and get the help that we genuinely need. It's not fair, but it's the way that it is. So it helps a lot if you have someone who's able to support you through that process. And what was also helpful for me is to physically write down or list out all of the questions that you want to ask about finding the right practice and all of the criteria that you need in that practice to be able to make sure that you've got all that information for every practice that you speak to, and if you put it in an email as well, then you can just send that off to various places. A lot of these places as well, they don't pick up the phone. You're just calling and calling and calling. They don't answer the phone. A lot of places don't answer your emails as well. Again, it sucks, but to me that's somehow a good indication of, well, even if you were a patient, even if you did manage to get an appointment and a diagnosis through them, you would never be able to reach them. So as difficult as it is, maybe they're not the best ones to invest your time in. Additionally, a hint for you, at some point, completely unrelated to this, I was complaining to someone here in Germany about how places don't even respond to the emails and stuff, and I keep sending follow-ups and no one's responding, and I got the hint that in Germany a lot of people have automatic spam filters that put any emails in English directly into spam. And so they said, here, even if you don't want to communicate with them in German, even if once you get an appointment or whatever it is that you want to deal with them in English, whenever you send an email, still send it in German, so then at least it won't go into spam. And since I started doing that, I've had a much better success rate of people responding. So if you're having that trouble, I would definitely recommend trying that. And just like, don't even try and like struggle through it yourself or make it fancy. Just put that into like Google Translate or something similar, just so then at least it's in German and they at least receive it, and then you can put in the content of the email that like, hey, I would need someone who speaks English, or you know, whatever the situation is for you in your country. Again, I'm talking specifically about Germany, but I think a lot of this, you know, could apply to other places as well. So it's already difficult enough to get an appointment with a psychiatrist, right? So when I was calling and emailing and everything trying to get an appointment, the first place I managed to get an appointment for was over an hour away from me. But I was like, fine, I just want an appointment. I just want the diagnosis and we can go for there. I can travel an hour for a couple of appointments. It's fine. And then when I got there, that's when I learned that because it's ADHD medication is a controlled substance, because it's Betäubungsmittel, not only do you physically have to travel to the practice for all of your appointments and checkups and stuff like that, you have to physically, personally go to the practice every single time you need more medication. Normally, like there's a lot of places where you just get like a repeat prescription service where you can just email them and they'll send it out to you, or you can send someone else to pick it up, or they can even send it direct to the pharmacy, or a pharmacy can go and pick it up and just deliver it to your house or whatever. With ADHD medication in Germany, you cannot do that. You have to personally, physically go into the practice every single time you need a new prescription. You can't send someone else for you, even if they have like a letter or a copy of your ID. You have to go there yourself. Again, because it's controlled substance, you only get like a month's supply of medication at a time, so you have to go there then every month. Again, I know, people with ADHD, how are we going to do that? Knows, and who cares apparently, right? And on top of that, in Germany then the prescription for ADHD medication is only valid for 7 days. So you then also have to make sure that when you pick up the prescription, or when you call and say, hey, I need the prescription, the date that is on the prescription, you need to know for a fact that you're going to be able to get to a pharmacy within that 7 days to fill out the prescription. Like, you can't pick it up on the way home one day on a Friday, then, you know, wait for the weekend, be traveling for 2 more days, and then once you get back, fill out the prescription. It's going to be invalid by then and you're going to have to go back. So yeah, there's a lot of practical issues. Additionally, because it's a controlled substance, you will not be able to get another prescription for ADHD medication until you have basically almost ran out of medication. So like within 3 days of running out, they will not give you another prescription. Again, because people who don't have ADHD are notorious for abusing our medication, and so they punish us. Even though they diagnosed us, they will not give us the medication they say we should have, and they make it very, very difficult to get access. So just to recap then. So basically what I'm trying to say with this is, as difficult as it already is to try and book an appointment with a psychiatrist to get your ADHD assessment, it's really, really important moving forward. If you want to get treatment, especially if you want medication, it's really important that you work with a practice that is close enough to your house and that it's practical enough for you to get to, because you will have to go there a lot. As if that wasn't bad enough, as I say, it's very difficult to get a diagnosis for ADHD as an adult. And I've already had to get 2 diagnoses in the space of 3 months. So once you manage to book your first appointment for an assessment, book another one. I'm so glad I did this. My partner said to me, like, hey, you know, aren't you just, you know, worrying too much? Like, I don't think it's necessary for you to put yourself through this. Why don't you see the first one first and then see if you even need a second appointment? And I insisted. I said, no, I've done a lot of research and it's going to give me so much anxiety if I just leave it with the one appointment. Please, I need another appointment. I need a second appointment with a second practice. And he said, okay, let's do that then. And I'm so glad I did, because then by the time I realised that the first place screwed me over, I only had to wait a couple more weeks to see the next practice because I'd already booked it in advance. So I definitely recommend you do that. Hopefully you'll be lucky enough that you won't have to use it, in which case please cancel it as soon as possible so that then someone else who needs the appointment can go ahead and take that. But yeah, I definitely recommend getting more than one appointment in advance with different practices. Okay, so then once you have the appointment, there will be a lot of waiting around to do until you can get the appointment. So within that time, definitely do more research, continue to empower yourself with knowledge, familiarise yourself yourself with what it's like to be assessed for ADHD. As I said, there is no one way to be assessed or diagnosed with ADHD, so every practice will do it in a different way. That being said, there are a lot of similarities with the tests. I'm not going to go into a lot of detail about this in this video. I will probably do a separate one just about that. Let me know in the comments if that's of interest to you and if there's any particular questions you want me to answer there. But while you're waiting for the assessment, definitely do some research about what that will involve and try to prepare for that as much as possible. In particular, without going into too much detail right now, I would definitely recommend that you look into the DSM-5 criteria for an ADHD diagnosis. Again, that's full of bias and stereotypes, but that's what doctors use. Read up on that, familiarise yourself with it, and I would really recommend that you document the symptoms that you have and the reasons why you think you have ADHD and why you want the diagnosis, and also try and document as many examples as you possibly can, because I mean, when anyone is just put on the spot with like a question they weren't expecting, it takes you a while to respond, and then when you do, it's probably not going to be like a full, sufficient answer, and then like hours or days later, you're like, oh gosh, I should have said this, and also this, and blah, 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 blah. And also, a major symptom of a lot of people that have ADHD is that we can't remember stuff. So even if like for a neurotypical person or someone who doesn't have ADHD, even if they're like, how can you not remember that? It's such a major part of your life. Or, oh, well, if it's that difficult, what, wouldn't you remember it? No, not if you have ADHD. So really spend time to just think about all your symptoms and come up with different examples, both from childhood and adulthood. That's very, very important. If you cannot demonstrate that you've had symptoms of ADHD since childhood, again, because of the DSM-5 criteria, you will not get a diagnosis. So that's very important as well. And I recommend that you start that process far enough in advance that you can mull over it in the back of your mind over a period of time. Because you know how it is, like, whilst you're trying to think of stuff, you can only get so far. And then when you're like cooking dinner, in the shower, about to get on the bus or whatever, things just pop into your mind. So as much as possible, give yourself time for those like unconscious memories to surface, so you can add those to your examples as well. I wrote a very, very long blog post about, my symptoms. I didn't intend for it to be a blog post. I intended for it initially just to be evidence, and then I decided I'm going to make it into a blog, so again, just to try and help other people. So I will put a link to that down below. It is very long, it's very detailed, it's probably not that ADHD friendly, but as I say, my main focus was just to do that brain dump, to use it as evidence. So you can check that out if you want to. I think it's also important to point out as well that even once you've had the assessment, you may not get the outcome that you want. It's very difficult to get a diagnosis for ADHD if you're not literally a boy, like a child boy, showing stereotypical symptoms of ADHD because of all the bias and the misinformation. And so even if you have ADHD, it's already going to be really hard for you to get the diagnosis. And it's also very possible that it's not ADHD, it could be something else. So just really be prepared for those possibilities. Try and think about some other possible explanations for your symptoms and your experiences. Try and, expand your research to those areas as well, so that if the psychiatrist says, well, we don't think it's ADHD, we think it's this, that you're already prepared with, okay, I had considered that as well. I've got some questions about this aspect or that. Or you can say, well, I did look into that as well, and I don't think it's that because of these reasons. I'm very much encouraging of empowering yourself with information, doing the research and having a basis of knowledge so that you can ask the right questions, push back, and really advocate for yourself. It's extremely common for people who do genuinely have ADHD to not get a diagnosis the first time. The further away you are from being the stereotypical boy with ADHD, the more likely you are to not only not be diagnosed with ADHD, but to be misdiagnosed with something else. So also kind of be prepared to have that conversation if necessary. And certainly, when things went downhill at my first practice and they started telling me all kinds of rubbish, it really helped that I had done so much research that I could be so confident that what they were telling me was not true. And I think because I was able to articulate my reasons for disagreeing with various things that they were telling me, because I was so articulate and confident in my pushback, I think that also was why they were like, hey, okay, we admit it, like, we don't know what to do with you, we're not sure how to help you. I think had I not been so informed, they would have continued to basically lie to me and try and convince me that they were equipped, let's say, to help me, and they weren't. So yes, knowledge is power, do what you can. That being said, I know that, especially for people who are neurodivergent, who have mental health issues, who whatever, are just generally in a vulnerable situation, I know that it can be very difficult to push back and advocate for yourself, especially, when you're in the moment, when you're a bit like taken aback and you're a bit kind of like, oh, like, I'm very much that way where if someone acts in a way that I'm somehow not expecting, or it's just like so outlandish to me, I do tend to have this thing where like I just kind of freeze up and I don't even know how to respond, and then I just walk out going like, what the happened? If you think that you might be in that situation as well, where you're not able to advocate for yourself, then there's two things that I would recommend. You can try and bring someone with you that you trust to be able to help do that on your behalf, who also knows about the research and, that you've been able to talk to a lot about that, who can push back for you. Again, maybe you don't have that person in your life, or because of the current situation, the pandemic, maybe it's not allowed to bring someone with you. The other thing I would recommend to do is to write down some key points from your research and write down some short key phrases of what you can say to object to certain misinformation that you anticipate could be told to you, and then that way you're not so much having to think off the top of your head on the spot. You can just kind of pull out the things that you wrote down and say, well, actually, okay, yes, this is what they've just said to me, and I know that's not true because of this. And then you can just directly say, this is why I don't think that's the case. And I think that could be really helpful in the moment. And then lastly, what I would recommend is to have like some sort of backup plan, or some sort of plan of how you want to proceed, even if you are successful in getting your diagnosis. So I said then, at the very start, think about why you want a diagnosis, what you actually want to achieve, and what you ultimately hope to get out of this process. Because say, for example, you say, I know there's something going on with me, and I think it's ADHD, but it might not be. I just want to know. And then if then you get told, oh, it's not ADHD, it's something else, maybe you say, okay, that's fine. Let me explore what this other thing is. Alternatively, you might say, either I'm convinced out of my research that I have ADHD, or I know I have ADHD because I've been diagnosed before, I just need to be diagnosed again for whatever reason. Then again, if you're unsuccessful with this, it's really great to have a backup plan, an appointment at another practice or whatever. And equally, if you do get a diagnosis, then it really helps again to have already thought about, okay, is that enough? Did you just want to know? Did you just want the confirmation that you've got the diagnosis? Or do you want treatment with medication? Do you want counselling? Do you want coaching? Whatever, think about what it is that you want, so you can have that conversation with the psychiatrist in that same appointment and not have to make another appointment and then come back again, because they won't always give you the result in the same appointment as your assessment. A lot of the times you will have to come back again in a few weeks, which is just a pain in the ass. So if you haven't already thought about how you want to proceed next, so that you can tell them, what to prescribe or whatever, or give you a referral or something like that, it will really help if you know that already, and then you'll, save a little bit of time by doing that. And similarly, if you have other comorbidities, such as depression, bipolar, anything else, it also helps to come with information about any existing medications or treatments that you're currently going through for these other things, because that could then have an effect on what will be recommended for ADHD, given that you don't just have one thing. You have multiple things, and they don't just exist in isolation, they exist together. You can't just take one medication one day, another medication, do you know what I mean? The sum is greater than the parts, so it's very important to have that full picture so that you can get the best treatment for you in your situation. And again, in that first practice that I went to, that was when they really fell short. They said that they specialise in ADHD, and then they admitted to me that they don't. And That was one of the reasons why their understanding and their ability to treat ADHD was so limited. And as soon as I made it very clear, like, look, I've got other stuff going on, they had no idea what to do with that information. They had no understanding of how my other conditions could possibly even have any effect on the ADHD, which to me is so basic and so ridiculous that they wouldn't know that. But that's the reality of the situation, and that's why it's so important for us to do our own research and put ourselves in a position where we are confident enough to push back when we need to. But as I say, it could also very much be the case that you genuinely don't have ADHD and it's something else. So really think about that as well. You know, it's very easy to have a hyperfixation and convince yourself that you've got something, whether it's ADHD or whatever else. I would say a lot of the time we're right, you know, if we know ourselves and we've done enough research. But if we haven't done enough research and we're just fixated, if we're only looking for things that confirm and we're not also expanding the research to consider other possibilities, then we can find ourselves in a very tricky situation. So that's why I really recommend looking at other possibilities as well, other possible things that could explain the symptoms that you have and the experiences that you have. And part of your assessment will be doing that as well. Like, there's no blood test, for example, for ADHD. A lot of it actually, unfortunately, is process of elimination. They will also be looking out to see if there's something else that explains your symptoms. So again, research that, look into that yourself, and you will either find reasons why those other things can be ruled out, or you could discover other genuinely possible explanations for what you have, which are definitely worth exploring. And then you can have more confidence in what you're being told. All right, so that was actually, that's a lot of information in this video, right? And as I say, I tend to go on and on, as a lot of people with ADHD do. However, I do still hope that you found this video helpful. Again, whether you're based in Germany or not, I hope that you can apply a lot of this information and that it was helpful for you to receive it. And again, this more of like a personal, human kind of format. I have so many ideas for videos, and there's so many other things that I want to share with you and help you with. So if you did find this helpful, please subscribe and turn on the notifications so that you know when I do release these other videos. Comment down below if this helped you. If you have any other questions, if there's any other topics that you want me to cover in future videos, please let me know. And also like the video if you'd like to share it with other people that it might help as well, you know, whether they need a diagnosis for themselves or even if it's, you know, someone that you want support from. You can share this with them as well. I hope that helped. I hope to post other things that will help. Thank you for watching. Very best of luck, and I will see you next time. Bye.